So good afternoon, everyone. You're all very welcome, and I see many dozens of you are still logging on, but we have a packed agenda for you this afternoon. Thank you for joining us. I'm Gráinne Healy, and I'm really delighted that you have joined us. Today's webinar, it's the 20th in our webinar series, and we're delighted to be delivering this session in partnership with the HSE. As always, we're very happy to take questions or comments from you, the viewers. Just use the chat function and I will convey your remarks or questions to the panel of guests with us this afternoon. For those of you on X, tweeting or Xing, we have a hashtag which you might like to use if you're on social media, right care, hashtag right care, right place, right time. Hashtag right care, right place, right time. And you're very welcome to use that. So Sláintecare then is about right care, right place at the right time by the right team. And we're focusing today on innovation and transformation in our health services. And we're delighted to be showcasing Smile 2. Smile 2 is a Sláintecare Integrated Fund initiative, which is testing the integrated virtual and specialist care of multimorbid chronic disease patients, and it is led by Dr. Orla O'Reilly. But before we hear from Dr. O'Reilly this afternoon and hear all about Smile from her and her colleagues, I'm delighted to start off the session this afternoon with some words from Rosaleen Harlan. And Rosaleen is the Sláintecare Communications Lead at the Department of Health. And Rosaleen will be giving us an update on the Sláintecare Integration Funds, supporting the innovative work in which so many of you watching today are engaged. Rosaleen, you're very welcome.
Thank you, Gráinne, and good afternoon, everybody. I'm just going to share my screen here with you now, so just bear with me 1 second. Great. So delighted to share the innovative work that is happening in the public service. And this innovation places patients and people who access our services at the heart of our health services. In the Department of Health, we have a dedicated multi-annual ring-fence funding for innovation, known as the Sláintecare Innovation Integration Fund. We are fostering a culture of innovation through the Sláintecare Integration Fund, and we're investing in new care pathways, new technologies, and new ways of working. And the fund was first established in 2019. In round one, we had an open call for projects, and we received 477 applications. Of those, we funded 123 projects. 106 of those projects have now been mainstreamed, which means they receive recurring funding annually. Under round two, 11 projects are being funded, and they all started in January 23, and we'll be hearing from one of those projects, the Smile project, later on today. Round three will have 8 projects, and they will be announced in December 2023. Setting outcome and output targets for each of the projects was a significant element for the programme and for the individual projects, because we needed to be able to measure the impact of each project as part of the proof of concept for making the business case to mainstream or scale the successful projects through the annual budget estimates process. And some of the typical outcome targets were, for example, the percentage reduction in waiting times or waiting lists, or the percentage reduction in ED attendance and hospital admissions, percentage reduction in referrals to scheduled care. Some of our key achievements are shown on this slide. As you can see, 123 projects were funded with a total of 28 million, because some of those projects had extensions, because as you'll be aware, they were happening during COVID. And you can see there are over 61,500 tests undertaken as part of those projects. Also, some of our key achievements and outcomes, and we do have a full report on the key achievements and outcomes that you can see that's available on our website. But some of the achievements from projects around one, that we had over 3,000 ED attendances were avoided, over 8,000 patients were seen from waiting lists, and over 15,000 people received more appropriate referrals to relevant health specialists in a community setting. And the staff involved in the projects were supported through a learning network. And this allowed projects to share their experiences and learnings from their projects and support each other to address the challenges. And also to date, we've had, this is our 20th webinar, we held 19 webinars between June 2020 and December 2022. And this was a great opportunity to showcase the work of those projects during those webinars. And we had over 11,700 people registered to join those webinars, and so we could share the learnings with them. Some of the other key resources that were beneficial to the projects included the HSE Change Guide. And this is an excellent resource which prioritises the focus on people in the management of change and recognises that middle managers are the catalyst for change. And it's also very important to mention that the HSE and the Department of Health, both the HR and finance services, were key enablers to the successful delivery of the projects. Projects from round one, we kind of looked at the learnings from the project's point of view, and what we found was, or what they told us, was their flexible approach to service delivery and additional time is required for the recruitment process. And the need to engage stakeholders early in the process is very important. And also the monthly outcome-based reporting significantly contributed to the successful mainstreaming of the SIF projects. And also they benefited from developing their project management skills. From a program point of view, some of the, in terms of our learnings, we looked at ways of strengthening the process. So how can successful projects be mainstreamed? And this is through the estimates process. And we know that the projects must be strategically aligned to policy and service priorities, which are aligned to the Sláintecare priorities such as reducing waiting lists, reducing attendances at EDs, and also shifting more care into the community. Also, the Department of Health and HSE assurance that the successful projects would be a priority for submission as part of the budgetary estimates process. And also the need for multi-annual funding was required to allow adequate time for recruiting, testing, evaluating, and mainstreaming the projects. So where to next? We want to develop a strategic approach to health innovation. So we will look to harness and integrate the work of other key stakeholders in the health innovation space and adopt a strategic approach to health innovation, which will be embedded in the new HSE health regions. The approach will be aligned to DEPR's Better Public Services, that's new strategy for public service transformation 2030, and making innovation real, the public service in the innovation strategy 2020. So just finally, in conclusion, I just want to thank you. I want to conclude that we see that innovation is important to integrating care, and we've seen the commitment and implementation focus from staff across our health services. So we have a real opportunity to continue implementing integrated care, and in doing so, to translate the vision of Sláintecare to reality. And I'm sure you enjoy hearing from Dr. Orla O'Reilly and the SMILE team about their innovation project and how it is making a real difference to patients. So thank you.
That's great, Rosaline. Thank you so much. And great to hear about the lessons learned from the wonderful projects that we showcased in the previous 19, but also I think to see the links, the learnings going forward. And certainly today, looking at SMILE, a really good example of innovation that for many of the patients is transforming the care and the quality of their lives is enhanced. So thanks very much, Rosie. That was great to have that update.
Thank you.
So I'd like to you now to meet Dr. Orla O'Reilly. And Dr. O'Reilly is the clinical lead for SMILE, and we're going to hear all about the work and how it's going. And I want to welcome you back because it's not your first time with us, Dr. O'Reilly. It's great to have you back to hear about SMILE too. But maybe you'd kick off with just telling us a little bit about, just reminding people what the key objectives for SMILE 1 were, and also maybe what that key problem was that you were trying to solve, and how you're now developing the resolution of that with SMILE 2. You're welcome, Orla. Thanks for joining us.
Thanks very much, Grania, and thanks for having us back. The problem, I suppose, both SMILE 1 and now SMILE 2 is setting out to address is the fact that people with chronic disease have frequent visits and often late presentations in their disease trajectory to the ED, to the AMAUs, and to the GP out of hours. And this, leads to suboptimal outcomes for patients if they present late. And obviously, nobody wants to present ED if they could possibly avoid it, and that sort of deterioration to be prevented. So that's the problem. As we know, the background that we're working in now is under the Enhanced Community Care Programme, the ECC programme, and we're currently setting up 30 chronic disease ECC hubs around the country, covering the whole population. And the objective of the chronic disease hub is to support GPs to manage patients at home and reduce unscheduled care attendance by properly managing people at home. And the model is succinctly described as a hub is a roundabout, not a car park. So it's to provide specialist input on a needs basis. It's not a kind of an ongoing care arrangement, so that a continuous flow of patients are there, and kind of it doesn't get full up, so to speak. But that being said, case management for very high need multimorbid patients is part of the model of care for the integrated care programme for chronic disease. And some of these patients will require more ongoing support than we can currently provide, either through the GP chronic disease contract or by the specialist hubs operating in this roundabout method. So for that small-ish number of patients, we need to be able to provide a case management, i.e. a kind of an ongoing minding service, particularly to encourage them and to enable them and give them the confidence to self-manage. But it needs to be scalable and it needs to be affordable, because when you look at the country, and we're looking at piloting a national model here, it must be delivered virtually if it were to be scalable or affordable. So as an example, a caseload for a virtual case management nurse would be up to 120 patients, whereas if you were asking a clinical nurse specialist in the hub to provide the same sort of care face-to-face on a case management basis, it would be a fraction of that. So the SMILE 1 project efficiently demonstrated that this virtual service was efficient, both financially and clinically effective for virtual case management, but it was a standalone service and focused on one particular area, the Carlow-Kilkenny area of the country, which is quite small and people know each other well. And we needed, so it can be done, but now SMILE 2, the objective of that is to integrate it with the wider ECC services. So if you wouldn't mind, the next slide, please. Great, so the objectives then of SMILE 2, similarly to SMILE 1, it's to empower patients to self-care and to improve their own health, and it's to shift care to the community and reduce unscheduled care. And then for SMILE 2, it's to integrate services with the other ECC services that are being rolled out, and to develop the processes and guidelines and inclusion criteria that are transferable and scalable that would enable a national scale-up, assuming the project is successful. Thanks, Gráinne.
Great, cut myself off there. Thanks very much, Orla, and we'll see Orla back later on as part of the panel. So very impressive initial comments there. I love the roundabout, not a car park, and that idea of people coming on, getting a service, going off at the next exit, I think is a very clear image for us to use about this initiative. So let's get some more of the detail of SMILE. Supporting multi-morbidity, self-care through integration learning and e-health. I'm really pleased to welcome Margaret Curran. Margaret, you're very welcome. Margaret is the General Manager of CareDoc. Tell us firstly about SMILE 1, which I know began in February 2020, some of its outcomes leading to SMILE 2.
Thank you, Gráinne, very much for the introduction and the invite here today. And as Orla described SMILE as being a support to patients with multimorbidity to help them to self-care and also to integrate and teach and provide e-health as the backup for patients. So we set out on a journey back in early 2020, and we called it SMILE. Phase 1 was commenced, and it was a novel way for patients living with chronic disease to self-manage their health. And our objections when we started out were to empower and educate patients to manage their own health and to take more control of their own health, to enable early identification of worsening symptoms, because we felt patients were leaving it too long to present to out of hours or to their GP for help, and that an intervention earlier would be very beneficial, to reduce unscheduled hospital and GP visits and improve the integration of services around the patient. Smile One was a standalone service. The technology and the research were supported by Dundalk Institute of Technology, Netwell Casala, and Trinity College Dublin. So what were the enrolment criteria for Smile One? We looked for patients over the age of 18 years of age with one or more chronic disease. And the diseases that were selected were the respiratory conditions such as COPD, chronic bronchitis, emphysema, asthma, cardiac conditions such as congestive heart failure and coronary artery disease, and diabetes type 1 and type 2. And the enrolment was through the GPs and practice nurses throughout the Carlow and Kilkenny area. So care was tailored individually for each patient, and each patient received a Samsung tablet and a ProAct application. They also received monitoring devices, and these were allocated based on the individual's chronic condition. For example, somebody with COPD had their Samsung tablet and application, they had their smartwatch, they had their O2 saturation monitor, and they had their blood pressure cuff. And the watch was very, very attractive, and patients took to the watch very well, because not alone did it do the monitoring, but it actually told the time, so it was very practical. And this monitored sleep patterns, activity, step count, and that was always a sign if things were going a little bit wrong. The step count or the sleep pattern would maybe be the first thing to be disruptive. So patients had specific thresholds that were set by the Smile nurses within the ProAct application, and alerts were triggered when the vital signs went outside of the set range. So then the Smile nurses reviewed the alerts and provided outbound telephone consultations, which were educational, motivational, and provided support on an ongoing basis to the patients. Patients self-reported on their mood and their pain levels, and they could load this onto the application as well. And over time, what we saw was that the frequency and the pattern of alerts stabilized, and that gave us great confidence in what we were trying to achieve. So what were the research outcomes? Well, patients gained a better understanding of their chronic illness. They were more confident in self-management. Patients were empowered to take control and an active part in their health and well-being. And there was increased awareness of their symptoms and the indicators of worsening health. Patients brought their tech to their GP appointment, to their hospital appointment, and they felt very empowered, because now they were coming in with the knowledge and with the data, presenting it to the clinicians. And they were no longer anxious as they used to feel previously, going in for maybe a visit and not knowing what the doctor was going to say to them. So 63% of the patients interacted with the platform on a daily basis. 74% reported more effective self-management, with many patients losing weight, increasing their mobility, and some stopping their smoking habits. 46% reported a reduction in unscheduled care episodes to their GP, to their out of hours, and to the EDs and the hospitals. Activity and mobility increased across all participants, which was really heartening. Now we have a little video to show you, and it showcases two of our participants from the Smile One project. And Tom is going to just play those. now for us any minute.
A project to help vulnerable people manage their healthcare at home is being tried out in Carlow and Kilkenny.
Smile involves patients using wearable technology which is monitored remotely by nurses.
Hello Joan, how are you? It's Emer, one of the nurses here from the Smile project.
At the CareDoc headquarters in Carlow, nurses working on the Sláintecare funded Smile project keep in touch with their patients.
The name we had from this project was that they would avoid unnecessary visits to the GP, avoid unnecessary admissions to hospital, and we have achieved that. We have patients that have had 6 and 7 admissions to hospital, and in the last 8 months have had no admission.
More than 150 over 65s in Carlow and Kilkenny are benefiting from the scheme, allowing them to use and wear monitoring devices to help keep control of their own care.
Well, every morning I take my blood pressure and my oxygen level, and it goes in on my tablet, and that goes to the nurses where they can view it and see how I'm doing and get back in touch with me, and if I have any questions. It's brought on my lungs immensely, my breathing, my heart. And also it picked up on, I had an issue with blood pressure, which I would never have known.
When you have the hospitals under pressure, and also I find with the elderly patients, they're not keen well, they may be reluctant to come here. Very few of them are keen to go to hospital. So if we can have something, if we can have enhanced measurement and do it in the community, that's the way for the elderly people.
During the pandemic, it helped health workers maintain a constant link with people with health issues, including cardiac patient and champion canary breeder Oliver Quinn.
It was great to to go and check your blood pressure. You're okay, so you don't have to worry, type of thing. It's it's a yardstick to the way you're feeling, your general health.
Conor Kane, RTE News, Carlow.
So now Smile 2. Smile 2 commenced in January 2023, and it's a joint initiative between the Enhanced Community Care Programme and CareDoc. It's integrated virtual case management of patients with 2 or more chronic diseases, and referrals are from the hub and also across all of the CHO area 5 now. So collaborating together, hoping and looking forward to improving our patients' outcomes. So what is the process? Patients are identified by the clinicians at the hubs using inclusion and exclusion criteria. So we've had referrals from nurse specialists, physiotherapists, dietitians, consultants. The referral is sent into CareDoc, into the Smile nursing team, and enrolment is completed. Communication pathways are agreed, and relevant parts of the care plan are shared with the CareDoc Smile nurses. Stronger linkages and synergies between the Smile nurses and the hub professionals are resulting in improved person-centred care. Hub staff will have access to patient Smile data in the very near future. Our expected outcomes by the end of Smile 2 are that patients will become even more empowered to self-manage. We will further integrate services around the patient. Patients will receive earlier interventions, thus decreasing their ED attendances. And we're shifting care to the community and reducing unscheduled care. Thank you.
That's great, Margaret. Thank you so much for that detail. I'm most impressed with some of the earlier figures, even from Smile 1. 75% of Smile users saying they can more effectively self-manage their condition. I mean, that's a fantastic statistic. And then the 46% having less of those unscheduled visits to GPs or emergency departments. So the technology is in hand, and those who are engaging are really finding it useful. Thanks very much, Margaret, for that, and we'll see you later on in the panel. Those of you who are tweeting, we're getting great traction today, so it's hashtag right care, right place, right time. If you wanted to put up a message or a comment, that would be great. I want to welcome now Agatha Lawless. Agatha, you are very welcome. And Agatha Lawless is the HSE Smile 2 project manager. Agatha, would you tell me a little about integrating the project with the chronic disease hubs?
Thank you, Grania, and good afternoon, everyone. Yeah, so integration and expansion of the Smile 1 project is really what's at the heart of the Smile 2 project. And what we're doing is we're building on the success of Smile 1 and the support of Smile 1 to be able to further strengthen patient outcomes and enable scale up. So how we went about doing that was we paid a visit out to the 4 chronic disease hubs in the southeast back in May to talk to the staff there about the project, to introduce them to it, because this is a new service now for patients with chronic disease. And we were really keen to find out how this project would fit into the work that they're already doing, because they're a new service as well. And that fit is really important for integration to happen. So we had really good conversations with all of the staff and took on board, their feedback, particularly around what Margaret was talking about there, the criteria, the appropriate types of patients to refer to this very sort of intense case management service. So those conversations were really useful, and we actually went back then in autumn again and paid a second visit with the hub staff, because we know how important it is to have staff involved when you're developing any new service, because they're on the ground and they know how it will work. So we built on the conversation and the dialogue that had started in the springtime, and it was really useful just to hear their input and to shape the project around what they were saying, to make sure it would work for them as well on the ground. Finally then, just in relation to expanding the project, and as Margaret has said there, we will be given access now to the staff in the hubs to be able to have visibility on the patients who are on the Smile project, and they'll be able to see, the live, like the real data as it's happening when the patients are inputting it into their tablets. So given the hub staff visibility on that is all part of integration with the chronic disease hubs and around the patient.
Great stuff. And I can see the importance of those communication channels, of everyone being on the one page. And I know, Agatha, that you've lined up some of the key staff to tell us about their work in the hubs. Would you like to introduce them before we go to the videos?
I will. Thanks, Grania. And I want to say a sincere thank you to the people who when I asked them to make some recordings, they did it very willingly, because we're feeling very passionate about the project. So firstly, we'll hear from Patricia McQuillan, who's an operational lead of one of the chronic disease hubs down here in the southeast. And secondly, then we'll hear from Liz Murphy, who's a cardiovascular nurse specialist down in the Wexford hub. And then finally, we'll hear from Daphne Masterson, who's an advanced nurse practitioner in respiratory integrated care. And Daphne is based in the Tipperary chronic disease hub. Thank you.
Thanks, Agatha.
Hi, my name is Patricia McQuillan, and I'm the operational lead for the Integrated Care Programme for Chronic Disease in South Tipperary, which is one of the 4 hubs in the southeast. In March of this year, I was asked to join the working group for the Smile 2 project, representing the chronic disease programmes across southeast community healthcare. From the start, the enthusiasm and commitment of Dr. O'Reilly and the CareDoc team was infectious. Coming from a background of general practice nursing, I understood the impact that this project is having for people living with chronic disease in the community, and how important the support of the CareDoc nurses is for them in their own home. It builds on the chronic disease service of delivering the right care to the right person in the right place at the right time. One facet of chronic disease is working with people to empower them to self-manage their conditions, to have knowledge of the disease, and to know when to seek additional help or advice from their healthcare professional before it deteriorates to the extent of a hospital admission. Some patients with chronic disease can self-manage, but there's a small percent that will need extra support to manage their condition, and these are the people that the Smile service works with. The Smile 2 team came to South Tipperary on 2 occasions to talk with the chronic disease team. They took on board feedback from the team as to how it would work for them in the service, users in their own home. This collaborative approach is beneficial for all involved, the patient, the healthcare professional, and the Smile service, as it means we will get the best outcomes for the patient. The chronic disease staff embraced the project, realising its value to a certain cohort of patients, and can already see the benefits to the patients through maintenance of their health and fewer calls to the healthcare professionals. Telehealth is part of our future, and I would recommend other hubs to avail of this service should it be mainstreamed.
Hello, my name is Liz Murphy. I'm the cardiovascular nurse specialist on the chronic disease team in Wexford. So we first got introduced to the SMILE project earlier in the summer when the team came down to visit us in our hub in Enniscorthy. I was familiar with eHealth. I've worked in Australia for 10 years on a chronic disease team in the community, and we had developed an app for our cardiovascular patients, a self-management app. It was really good and the outcomes were great, but the nurses were in charge of all of the deployment, the alerts, the phone calls, etc. So along with usual care, it was very time consuming. When the team from SMILE explained the project and explained the level of support, the sophistication of it, the equipment involved, I was really excited and we're really looking forward to collaborating with them. So the patients that we would refer are usually patients that are living with heart failure and that are multimorbid. The nature of their illness is quite brittle. So even though they might be very stable with me in clinic, I do know that they can deteriorate very, very quickly. So to know that we can refer these patients to a service that's in the background, remotely monitoring them with that level of support and minding them, it's truly invaluable for this cohort. So when I initially identify somebody that I would believe would really suit the project, and I discuss it with them maybe in clinic. Initially there's a little bit of apprehension, especially around the technology side of it. But now that I know the process of how the deployment happens, how the nurses phone them, how, and that's especially in those first few weeks when they're quite vulnerable about it, and that they'll get the support that's required, and that there is no pressure if it doesn't work, it's okay. So of the sort of patients that I have referred, about 80% of them have enrolled. And when they're coming back to me after they've been enrolled, especially after the first couple of weeks, even the first few months, I would say the level of confidence is so much higher in terms of managing their condition, managing their symptoms, and even the understanding the correlation between the clinical measurements and their symptoms. It's so much better. Also, I would maybe have developed an action plan with them in terms of diuretic therapy, and they may have tweaked it a bit so that they can manage their symptoms a bit better. So look, overall, I would say this is an amazing service that we have the opportunity in Wexford to refer our patients to, and we are so lucky to be able to do that. And I really look forward to collaborating and integrating with the SMILE team into the future.
Hello, my name is Daphne Masterson and I'm a recently registered advanced nurse practitioner in respiratory integrated care here in South Tipperary. And I've been a respiratory nurse specialist for over 20 years with both hospital and COPD outreach experience. And I've moved at the beginning of 2022 to the integrated chronic disease team. At the moment, in my role with my two physio colleagues, we run GP referral clinics predominantly for patients with COPD and asthma, and we also run pulmonary rehab classes in various locations throughout South Tipperary. The SMILE project was first introduced to us in May of this year, and it's actually proved to be a really invaluable resource to us, not just in the respiratory team, but also in the cardiac and the diabetic chronic disease teams. Our focus is on episodic care, and in that we optimise the patients both pharmacologically and non-pharmacologically. And our role also is to enable and promote self-management so that the patients can actually manage their own chronic diseases. And part of this is that we signpost the patients to any resources that we feel may help them on this journey. And the SMILE project absolutely fills the gap for our patients, and it's reassuring for us that we can refer the patients on to a support service and a coaching service that will actually help them to help themselves. The referral process for the SMILE project is actually really straightforward. It's a short online form, and we email that to one of our admin support people here in the chronic disease team, and he then is the link between us and the SMILE team. When we mentioned the SMILE project to the patients initially, I suppose their initial reaction is one of fear and anxiety as to whether they will be able to manage it, and especially the equipment and the IT support. But once you reassure them from an IT support point of view that they will have not only just a home visit, but ongoing telephone support to be able to help them to manage the equipment and the IT side of it. it's a really good process for them, and they really find it so useful. We also keep the GP informed as well, and when we write our letter to the GP informing them of any resources that we have referred the patient to. Our aim, like I said earlier, is to support the patients medically, pharmacologically and non-pharmacologically, and we attempt to get the ducks in a row, to line up those ducks. And when we refer the patients on then to the SMILE team, they take over from our role, but also support the patients, educate the patients, and also just promote confidence in the management of their chronic disease. Thank you.
That's great. Thank you very much for those insights. Finally, in this segment, and importantly, we have a clip of two more of the participants speaking about their experiences of SMILE. First up, we'll hear from Eileen O'Donnell. Eileen is 72 and she's engaged with SMILE. And then secondly, we'll hear from Gerard O'Connor, a retired healthcare worker.
My name is Eileen O'Donnell, and I'm a 72-year-old mammy and nanny and wife, but I have a lot of problems with my respiratory illnesses. I suffer from bronchiectasis and COPD. And in the past 2 years, I've been admitted to a hospital 3 times, twice in connection with respiratory illnesses. First time I had pneumonia and a small clot in the lung. I have enrolled in COPD classes under Daphne Masterson and Niamh Julian and Sinead Delahunty, which were fantastic classes, and got numerous help, information and guidelines and guidance how to manage my medicines, list them, know what they were about, how to use inhalers, spacers and so forth. I have been seen by Daphne in the clinic in St. Vincent's Hospital a few times, and she recommended different things to be done to help me to the GP, which were done, and then got the results back, and I got copies of them, and she was able to explain everything to me, which removed all the mystery. So when she said she was clear that she felt she could do no more for me, she thought it would be a good idea to enroll me in the SMILE project. SMILE project is like a security blanket that anyone who has anything serious wrong with them should have. On the SMILE project, you're supplied with a tablet, Samsung, a smartwatch, blood oxygen recorder, blood pressure cuff, and you're shown how to take them yourself. And this is major, this is great. And it's all, you input it all into the tablet and they can read it at their end. So if anything untoward is coming or it doesn't look great, they will get onto you immediately. And that in itself is invaluable. There isn't words that can explain that.
And would you recommend SMILE?
Oh, I'd recommend it 110%, even 150%. It's the most certain at this stage because hospitals are so busy and full and all the rest of it. I think community care is the way to go, and that would be of huge benefit to people.
My name is Gerard O'Connor, 69 years of age, retired healthcare worker.
And where did you hear about the SMILE project?
I went on a pulmonary course, rehab course down Enniscorthy and physios introduced me to it. I have COPD, heart problems. I have high blood pressure, which is under control now, thanks to the Smile project. Go to my GP every 6 months for a checkup. Okay. It's usually a little high. And then when I went on to the Smile, it was off the scale. So I went back to my GP and
the nurses phone. Did the nurses phone you?
Oh, yeah, the nurses informed me of I need to go to see my GP because my blood pressure was very high. And I went to my GP and explained about the Smile project. She thought it was very good as well. And she put me on different tablets till we got it under control. And now it seems to be working.
And how do you find using the technology, like the blood pressure cuff and all of that? Is it easy, or do you find it difficult?
It's very easy to use. It's not complicated at all.
Okay. And would you have you just built in kind of taking all of your blood pressure and all of that? Have you just built that into your daily routine?
I have, yeah. I take it first thing in the morning after the nighttime medication, and then I leave it for 3 or 4 hours and try it again when the morning medication kicks in.
So it's just part of your working day now.
It only takes a few minutes.
It's not too cumbersome.
No, it's not
intrusive. It doesn't take over.
No.
Would you recommend the project to other people?
Oh, 100% anybody would, yeah.
Yeah. And do you think it's made a benefit to your family as well?
Oh, yeah. Because we didn't really know why all the headaches were, and the tiredness was just putting it down to old age, I suppose. And then when as I say, when the Smile came along, they informed me what they were going to do and how to do it. And when it started, my blood pressure was way off the chart, and they phoned me and told me to visit my GP, and I did. And very thankful for him that.
Great stuff. I love Eileen's description of her experience of Smile as being like being held in a security blanket. And the key element of the patient satisfaction that we're hearing across the patients we've heard from today seems to be echoed in Jared's words about using this technology. It's not complicated at all, he tells us. So that's full marks to the staff who have introduced the patients to the technology and supported them in the usage. So thank you there to Patricia, Liz, Daphne, and to both Eileen and Jared. We'll see Agatha later in the panel session. Turning now to working with Smile participants on the integration and communication protocols. Niamh Flanagan is a CareDoc triage nurse. You're very welcome, Niamh. Niamh, could you, as the first point of contact with Smile participants, how do you get the participants on board?
Thank you very much for your introduction. I suppose the easiest way to explain how we get them on board is to tell you what our working day is. I myself have been working in the area of telephone triage nursing with CareDoc in the out of hours service for 16 years. In 2020, I transferred to the Smile nursing service, and I've gained invaluable experience and insight into managing chronic disease patients with the support of technology. There are 6 nurses on the Smile triage team. We're all very enthusiastic about what we do. We're very passionate about it, and we receive referrals for the patients from a wide variety of sources. For example, from general practitioners, clinical nurse specialists, physiotherapists, and consultants. The Smile nurse becomes part of the patient's social care network, and we build up a professional and therapeutic relationship with the patient and indeed with their families. We make regular planned outbound calls to the patients, coaching and educating them about their health and encouraging them to set and achieve goals and make small changes which improve their overall health and well-being. With the support of technology, the nurses monitor vital signs, sleep pattern, step counts, and self-reported change in the moods of the patients. And if these are outside of the parameters that are set for the individual patient, we make contact with the patients by phone. We discuss how they are feeling, what's going on for them, and that which might be the cause of the issue. So in collaboration with the patient, we agree a suitable course of action and we plan our next call to them. Where the Smile nurse would determine that the patient may need further medical assessment or intervention, it might be required, the patient is then referred back to their general practitioner, their clinical nurse specialist, or their hub professional.
Great stuff. And Niamh, what are you hearing from the participants using the service? I know you've put together some case studies to briefly tell us, what are they saying to you?
Yeah, I think that's probably the easiest way to show you how the patients feel about the project. So I'll just share a couple of stories with you about some of the patients that are on the Smile programme. John is a 70-year-old gentleman who lives alone. He manages COPD and hypertension. In 2019, John had 6 admissions to hospital, which resulted in 47 nights in hospital. He enrolled in the Smile project in 2020, and with a lot of education, encouragement, and motivation, John made huge lifestyle changes. He stopped smoking, he gave up alcohol, and he is now an avid walker. John has actually had no hospital admissions since joining the Smile programme. And as John has said, COPD controlled my life for a very long time. And now I am in control of my COPD thanks to the support of Smile. Dolores is a 78-year-old lady who lives with her son. She manages heart failure and COPD. She's had numerous admissions to hospital due to her chronic conditions. On observing her vital signs over a period of time in her early stages of joining Smile, it was noted over a 72-hour period that her oxygen saturation and her blood pressure had dropped. On contacting Dolores, she admitted to feeling very unwell and exceptionally tired. The Smile nurse liaised directly with the heart failure team, who arranged to see her in clinic that afternoon. Her medications were adjusted and a hospital admission was avoided. Dolores was feeling much improved over the following days, and she remains stable at home at present. Dorina is a 67-year-old lady who lives alone. She's hypertension, type 2 diabetes, sleep apnea, and obesity. She lives a very sedentary lifestyle, and she was very debilitated by her comorbidities and was incredibly anxious about her overall health. And gradually, with gentle encouragement from the Smile nurses, she's increased her daily step count from 200 steps per day to 3,000. She's lost weight and she's much more focused on her health. Indeed, her recent blood test for blood glucose, or HbA1c, was within the normal range, and she was seen by her consultant a few weeks ago, who's delighted with her progress. So overall, I would feel the integration of the Smile project with the enhanced community care programme, it's a huge win for everyone, especially our patients.
Yeah, well said, Niamh. They're great stories. Thanks so much. And echoes there of what Gerard and Eileen told us earlier. It's clear the improvements for the patients are really coming through with their engagement. Thanks for all your work as well, Niamh.
Thank you very much.
Thank you. We're going to move now to the panel discussion and have a look at what's working well, the next steps, but also we're getting a lot of traction, a lot of questions coming in, which is fantastic. Welcome back our panellists, Dr. Orla O'Reilly, Agatha Lawless, Niamh Flanagan and Margaret Curran. Orla, I'll go back to you, if I might, in the first instance. A question has come in from Anne Lister, and she's wondering, is there a plan to roll this out to other hubs?
Well, we hope so, Anne. This is a Sláintecare funded project, so obviously it depends on successfully delivering the project objectives and it being judged successful. And assuming that does happen, which we're very confident it will, we will be looking then for mainstream funding to basically spread it out to other hubs.
Great. Would you talk a little to me about the challenges that you face in developing, because it is innovative, there's a lot of moving parts. What have the challenges been?
Yeah, it is complex, and integration is complex and change is difficult. And I suppose we have experienced that ourselves. So the speed of recruitment of our patients wasn't as quick as we had, I suppose, anticipated when we kind of dreamt up the project and put down our project plans last year. But what we found out is that integrating with the hubs. There's 30 hubs. Every single one of them is at a different stage of evolution. You know, there's 4 hubs here in Kilkenny. There's 3 specialty sort of sub teams in each hub, and there are the linked hospital integrated care teams. So that's like 24 sort of subsets of people, and there are about 250 GPs. So in all, there's about 300 to 400 actual referrers, which we have to sort of persuade of the benefits of this project. And I suppose, you know, that is big, and it's taken time. And you know, we realized very early on in kind of the spring that we were going to have to go out and tread the roads and meet everybody, and not meet them once, meet them numerous times. So Agatha will tell you more about that, or has told you more about that, sorry. But you know, going to meet the hub teams, the acute teams, the GPs in various fora that is suitable for them and convenient for them around the region has been a huge piece of this integration. And you know, they're all at different levels of recruitment. None of them have full teams. Some of them don't have consultants. Some of them don't have nurses. Some of them have nurses in some specialties and not in other specialties, and so on and so forth. So really, it has to be tailored for their reality on the ground now. And we have started or are working now closely with them to develop communication protocols particular for their situations, and that is a complicated matter. Right. So we're working through the various things there. We've also discovered, I suppose, that there are quite a lot of staff fears, and because I suppose Smile 1 was a kind of a simpler thing in that it was a smaller area. CareDoc is very well known in Carlow Kilkenny and very well known by the GPs, and they were the referrers there. This is a more complicated thing. It's with groups of clinicians that wouldn't normally be referring to this type of service, and maybe they aren't as familiar with all of us as heretofore. So there were staff fears both with GPs and with the hub staff about increasing their workload and would it work and so on and so forth. So we've worked through that, and there's patient fears then, which usually revolve around their ability to manage the IT. But in fact, that has proven, you know, once they engage, that has proven not to really be an issue at all. But it takes time.
And I think we saw a lot of that in COVID times, with people learning to WhatsApp their family, and in some ways it hushed people over the fear of technology. Orla, can I go to Agatha and just ask you, is it something you'd like to add to what Dr. O'Reilly said there about responding to the challenges?
Yeah, I think what Orla was saying there, so we focused very much on the hubs initially, but as the project progressed and we were looking at the rates of referral, we realised that we needed to go back into the hospitals and engage with the integrated care staff in there who are seeing the patients that are suitable for this project. So that has kind of been our focus for the last 2 months. So we've met the staff in St. Luke's and Kilkenny, we've met the staff down in Wexford Hospital, we're working on Waterford and Tipperary hospitals. We've linked in with the GP leads for the community healthcare networks. We've linked in with the GPs on their CME meetings. So we're working really hard to meet all the wide range of people that can refer in.
Yeah, and just a question that's come in there. Jacinta is wondering, are the Smile nurses trained as nurse specialists in each or all of the chronic diseases mentioned, like COPD, diabetes, coronary disease? Are they all trained in all of those specialisms?
So I'm going to hand that question over maybe to
Ivan.
Yeah.
But I suppose we all have training in certain areas. I wouldn't say we're all trained in all of it, but we all have ongoing education on a regular basis to keep us up to date with what's going on for the chronic diseases. Great. So yeah, we would be very up to date on all our education.
And I think more importantly, Grania, there is, and Niamh is probably not selling herself, our nurses have vast experience in remotely managing patients, which I would say they are the most experienced triage nurses that exist on this planet.
Yeah, I can see that, the importance of that. And Margaret, coming to you, there are loads of questions coming in for you. the idea of the question that has come in from one listener is, has it been considered to co-locate the SMILE team in the hubs so that they are in effect one team?
What I would say to that, Grania, is we are one team. I think we have to forget about buildings and walls and rooms. We have a very sophisticated infrastructure in the CareDoc headquarters. We have the most specialised nurses in remote assessment and triage. We don't need to be in the room next door. We are connecting to our patients and connecting to hub staff virtually by technology, and that's the enabler. And I think this is where this project is so special and is so innovative, because we're using technology to reach out and integrate and collaborate with our professionals across the HSE and, most importantly, our patients.
And I think that is an interesting point about the integrated element of this, that, as you say, the physical walls, this is virtual is so important. Some questions, and again, Margaret, maybe to you, what are the operating hours? What happens if people have out of hours issues? Is it free? What's the age range? People just looking for some of the basic information.
Yes, it's for total population, so we don't discriminate against private or public. If somebody has 2 or more chronic diseases, they are eligible. To join the program. Now, the other question was, sorry, Grania, just went out of my head.
No, just the operating hours.
Oh yeah, the operating hours are during the daytime, Monday to Friday. Now, patients are educated by the nurses that if they become unwell, and this goes for daytime, if they become unwell and it's serious, that they need to take the appropriate action, and that would be contacting their GP in the usual manner. So the nurses arrange outbound calls in the main to the patients. However, if alerts are thrown off during that time, they will make a call, and generally the patient knows when the nurse is going to ring them, because now they know that their alerts are gone out of order because they're looking at it on their Samsung tablet. So it's all part of the educational of the patient.
Jerry, we're getting some great feedback. I'll just read one of them. SMILE is a fantastic project. Congratulations to all involved. The patients' experiences are truly a delight to see, which is a great one. There are some questions then around governance and who retains governance of the patients through their time in the SMILE. That's more of a technical question, maybe, Orla, coming back to you on that one.
Well, it's the patients living in the community, so the overall clinical governance of the patient is with their general practitioner.
Yeah. And there's a specific question around the ICPOP program, which somebody from Galway has texted in. Is the SMILE program, is it the same as the ICPOP program, which is in Galway? It's not the same thing, it's not all.
No, it's not. It's part of the integrated care program for chronic disease, and we're piloting it here in the Southeast.
Very good. Great stuff. So maybe just next steps, Margaret.
Next steps, well, we'll continue to recruit and enrol the patients into SMILE 2 and continue to increase the clinical stabilizations of the patients to avoid ED in hospital. That's the important part. Improve the quality of life as well, and build on the collaboration and the integration between the SMILE Hub, the GPs and the SMILE team, and develop further pathways as we move along. And hopefully by the end of 2024, we'll be looking at upscaling this and rolling it out across the country. That would be the vision and that would be the plan. But we have a little bit to go before then. We have another 12 months or so to prepare for that.
You have, but you're well on the way by the sounds of all that we've heard this afternoon. I mean, a lot of what we do in these webinars is try to look at all the good stuff, but also try to dig down into the lessons around the challenges. And I think we've done that somewhat here today. So Orla, a last question to you about resistance. Has there been significant resistance to this? What have you learned with regard to future rollout, particularly as Margaret says, over the next year? What's to be done, and is there resistance to be overcome?
We have been surprised. There's been almost, if no resistance to staff once we get to meet them face to face and explain how it's done and allay their fears, mostly which were about the technology and their patients' inability to use it, or that it might increase their workload. Yeah. But the challenge, I suppose, the main challenge, I've referred to it already, is actually that takes a lot of time. So, and we have found that there is no substitute to meeting them in person,
face-to-face.
and not once, but several times, and repeating the message.
Yeah.
So I suppose that's the kind of the rate limiting factor, you know.
Brilliant, great. Final word, Aoife is saying, this sounds like a fabulous programme. Here's hoping Smile can be rolled out nationally. Brilliant, empowering patients and encouraging the active involvement in managing of their own illnesses. She could write your brochure for you. She's really got it, hasn't she? Thank you to everyone who participated this afternoon. It's a brilliant programme. Well done to you all. I want to thank all of our guests here today, all of the panelists this afternoon who featured, all of those who featured in the videos. I want to thank the whole team who helped produce this session, in particular Rosaline Harlan and Tom Duke, who really makes the technology work for all of us. You can watch this webinar back or recommend it to your colleagues. It will be available on the Sláintecare website. So from me and all of the team and everybody this afternoon, thank you very much and continue to stay.
Thanks, everyone.
Thanks, everybody.